mission of the Greenville Free Medical Clinic is to promote wellness and to provide quality, caring, primary specialty medical care, dental services, prescription medication, and health education to the low-income uninsured individuals in Greenville County. As such, for the last 23 years, we have provided care for the most vulnerable patient population in Greenville County. Those who are working but perhaps have jobs that don't provide insurance for them. They may be between jobs. They really are the folks that need help the most and don't have access to that health coverage. I think early on, when the concept and the idea of even developing a free clinic was being bantered about in the mid-'80s, the St. Francis Hospital leadership was right on board and recognized that this was something that our community needed. And they have been side by side with the free clinic and always had leadership involved, had active participation on our board of directors, had volunteers encouraged through the hospital system to become involved as nurses and pharmacists and physicians volunteering at the clinic. And certainly the management and leadership team within the mission services, which is such a natural fit with St. Francis and the free clinic to be side by side reaching out and providing those services. But it goes back to the very early days of when the clinic was first started to be talked about, and perhaps without solid community support and hospital leadership, it may not have become the strong, credible, comprehensive service and organization that it has become. The fact that the Greenville Free Medical Clinic's main location is about 4 blocks from the downtown St. Francis Hospital has always meant that we've had a very close relationship. We're practically in each other's backyard, so it makes the most sense to reach out particularly to the neighboring community surrounding our neighborhood here to make sure that they in particular have access to health care. There's lots of opportunities that in working together, the hospital is of benefit to us. Their leadership, their stature in the community, their position within the healthcare world to be able to, with a louder voice than a small nonprofit free clinic is able to say, this is an important issue, providing care for the poor, reaching out to the uninsured. It's important, and hospitals supporting that effort benefit the community certainly and make it a healthier hospital system at the bottom line also. Many times at our clinic, patients have not always been used to being treated with a lot of dignity and respect. Some of the lowest income patients, some of those who have been fairly downtrodden have been kind of shuffled through systems in the past. So when they come to us for help, we look to our partners for that compassion, that caring, and really through the volunteerism, through the support, and through a lot of the resources of hospital personnel and activities and things that they're involved with, we've been able to then carry that through and share that with our patients. The mission of the hospital and the free clinic are hand in hand, really reaching out to make sure that access to health care is not limited to those are able to afford it, but is available to all of our neighbors.